Because of those fires, Colorado's air quality is as bad as it's been in years.
Add in a disease that goes straight for the lungs, and we have a situation unlike any seen before.
Denver 7's Jason Grenauer tonight on the smoke and just who it's hitting the hardest. Jason?
Yes, and usually, guys, from our Denver 7 roof, you can see some clearly defined mountain peaks and levels and a pretty clear start to the sunset. But yesterday, today, even tomorrow, get used to that haze that's bringing with it some added concern for more people than usual this year. It may give us great sunsets, but the smoke from Colorado's massive wildfires is starting to have more of a negative impact on the Front Range.
I feel it particularly in my eyes.
After I stepped out for a little bit this morning, and I could smell it.
From Grand Junction and Glenwood Canyon to right outside your Front Range front door.
And now that smoke is starting to settle to the surface of the earth, and we're seeing really high fine particulate concentrations throughout the Front Range region.
Scott Landis works for the Air Pollution Control Division of Colorado's Department of Public Health and Environment.
If I had to put it on a 1 to 10 scale, I'd probably say it's a 7, maybe even an 8. Certainly the fires are still producing smoke, and we can get another dose of the smoke Thursday night into Friday morning.
Those particulates plus elevated ozone levels have forced CDPHE to issue an air quality alert and action day. That happens almost every year, cautioning those with heart or lung conditions. What makes all of this worse this year is that it's all happening during a pandemic.
This wildfire smoke can actually increase some of those symptoms that you have when you have COVID-19. And also it could make you a little bit more vulnerable to COVID-19 because the smoke can work to really break down your immune system.
More people may have problems related to the smoke quality than in years past because more people right now are dealing with respiratory complications from the virus.
Dr. Eric Hill runs the ER at the Medical Center of Aurora and says smoke by itself may not increase your risk of getting COVID-19. But what you do in response to poor air quality could.
But if you change your behaviors and start doing things that you weren't doing before, that potentially could increase your risk.
Now, there is some good news coming. Those winds, the transport winds that push that wildfire smoke here to Denver and the Front Range, they are forecasted right now to shift at some point tomorrow, which means that Denver and the surrounding area should see some relief from that smoke by this weekend. Reporting live tonight, I'm Jason Grenauer, Denver 7.
Yeah, it is thick out there. Thanks, Jason.